This is James with Net News Ledger. We have somewhat disturbing news tonight from the Thunder Bay Regional Health Sciences Centre. A doctor from Southern Ontario who's been working at the hospital and treating patients has tested positive for COVID-19. Now, this test has, according to hospital officials, as many as 100 people who have been exposed to COVID-19. Testing is underway. There's some people being self-isolated. This is a developing story. There was a press conference that we were able to participate in at the Thunder Bay Regional Health Sciences Centre by technology, and there's a lot still to come on this story because there's bits and pieces we're still not getting. Now, we're going to be following up to get the information for you from the hospital officials as they try to get the information as they work through their system. Here's today's press conference.
Everyone. Thank you for joining us today. My name is Tracy Smith. Really appreciate our media partners joining us. As you know, we very much rely on you to help inform the community of developments here at Thunder Bay Regional Health Sciences Centre. So today's format is going to be, I'll do a little bit of an introduction. Dr. Stuart Kennedy, who is Incident Manager for Thunder Bay Regional Health Sciences Centre's COVID-19 response, will make a statement. We will then work with some previously or pre-submitted questions from some of you, and then we will jump to questions submitted during this portion of the activity. So you can continue to submit questions. As per the instructions, we'll receive those and we will address those. So I'm going to begin by welcoming everyone to today's situation report for Monday, June the 1st. As you know, my name is Tracy Smith, Information Officer, and I'm here with Dr. Stuart Kennedy, who is Incident Manager with Thunder Bay Regional Health Sciences Centre's COVID-19 response. So we will turn things over to Dr. Kennedy to provide a statement and an update regarding our current situation. Dr. Kennedy.
Thank you, Tracy. And I'm joined in the room right now by Jean Veratowick, our CEO of Thunder Regional Hospital, Dr. Greg Campbell, who is Chief of Infectious Disease, Dr. Zaki Ahmed, who is our Chief of Staff, and Dr. Peter Voros, who is our EVP of Clinical Programs. So what we'll do is we'll read a statement, and we'll certainly take questions from the media, and we'll delegate the answers to the appropriate individuals in the room. As you are all aware, June 1st was the beginning of our recovery day, where we're going to increase our elective surgery by 25%. And I'm going to outline a story why that has not happened, based on some new information and an index case that we were aware of last night. So throughout the COVID-19 pandemic, the health and safety of patients, staff, and professional staff, and the community has been our utmost priority. The hospital's incident management team is disheartened to report that there is a possible COVID-19 outbreak currently under investigation at our hospital and within the Thunder Bay District of Thunder Bay. This development is certainly upsetting to everyone involved, and we recognize that it may increase anxiety with a number of people at the hospital and in the community. We will work through this together. We are collaborating with Thunder Bay District Health Unit and our infection prevention and control experts to trace contacts. All known contacts, including patients, staff, and professional staff, have been or will be tested as soon as possible. The total number of people possibly exposed will be determined through this investigation, but is expected to be higher than 100. The staff and professional staff tested for COVID-19 as a result of this incident will continue to work unless they display or suspect any symptoms. We expect personal equipment, PPE protocols, to be meticulously followed. We must and will do everything in our power to limit the risk of spread. Precautionary measures are being implemented to protect all, including restricting all non-essential entrance to this hospital. This includes the cancellation of non-essential procedures, such as non-urgent surgeries and ambulatory care appointments. Every effort to contact impacted patients is underway. We understand that further delays in these services may be frustrating and very disappointing to our patients. Outpatient dialysis, cancer treatment, and pediatric activity will be maintained. Those who require urgent care will receive it at our hospital. In addition, we must extend further essential care partners restriction until further notice. At this time, essential care partners are only allowed for birthing mothers. These restrictions are difficult but necessary. Virtual visitation options are available for all patients at this hospital. The possible outbreak is the result of a locum physician testing positive for COVID-19. We were informed of this result last night at approximately 9 o'clock. The physician, through his employment and through his care of patients, worked in several areas of the hospital over the course of 6 days before testing positive. Certainly, we've talked to the health unit and we've talked to our head of infectious disease. The risk of this individual is low. And I want to emphasize the risk of this individual is low, but we are taking all specific precautions to make sure we have good containment. Regarding the locum status, despite extensive recruitment efforts, our hospital in critical areas is still highly dependent on physicians who live elsewhere to provide critical care services in northwestern Ontario. At the beginning of the pandemic, we restricted any travel from outside northwestern Ontario. Those restrictions were decreased to ensure the provision of care as local physicians began to experience exhaustion due to extra work required to meet the demand. All essential physicians from outside northwestern Ontario are screened prior to arrival to this region. Those who develop COVID-19 symptoms or have suspected exposure are tested. While working at our hospital, they must wear masks and gloves during these patient interactions. The physician involved, who cannot be named due to privacy regulations, has been a dedicated healthcare physician at Thunder Regional Hospital since 2004. This physician did work in the ICU and throughout the hospital from May 25th to May 30th and was taken off work on May 31st after a declaration of symptoms and testing performed. The testing was positive for COVID-19, and this patient or this physician is now in isolation. We are deeply troubled by this incident, and it will have a great impact on patient care and delivery in this region. In order to avoid a recurrence, we have again minimized any travel of healthcare providers from outside northwestern Ontario. Those who are absolutely essential will be tested with a COVID-19 swab, even if asymptomatic. If they have any symptoms, they will be swabbed again in 48 hours later prior to being allowed to work. If they are symptomatic, they will not be allowed to work, even if COVID-19 negative. Our focus at this time is to contain the spread and protect patients, staff, professional staff, and community members. Undoubtedly, there are questions regarding professional ramifications. Such decisions are being investigated. We are monitoring the situation very closely and remain committed to transparency. Regular updates of this situation will be provided. So it's an ongoing investigation. We have ongoing testing done as we speak. We will get priority testing done of all our healthcare workers who've been exposed to this physician. But I do want to really reiterate one more time, this is, with the basic information we have, a low-risk situation. Tracy.
Thank you, Dr. Kennedy. I want to offer just one point of clarification regarding essential care partners. That being that in addition to birthing mothers, essential care providers are permitted for women and children's program. A parent or guardian will always be allowed to accompany a pediatric patient. Dr. Kennedy, do you want to speak a little bit to how this might impact our plans for recovery that were to begin today?
Yes, so we are reverting back to where we were last week. We were planning to increase our elective surgeries and procedures by 25% at each program, but we are going to wrap that back down to where we were last week. So all non-essential surgery, procedures, as well as diagnostic investigations will be canceled for 1 week. We will relook into the status and the need to move forward after we get more information back about our test results. If our test results are coming back negative, we're going to revisit how long this will go on for, and this is an ongoing type of assessment and evaluation, and I don't have when we're going to reopen again for that escalation.
Okay, thank you, Dr. Kennedy. I'm going to turn now to some pre-submitted questions. Many of them have been answered already, so I will skip past those ones. Those that have not been directly responded to, I will read out. This one comes from Troy Charles with TBT News, and it is, we heard that this doctor could have been in a Southern Ontario hotspot where they contracted the virus and brought it back to Thunder Bay. Can you confirm or expand on this?
I can certainly confirm that was not the case. We have a strict protocol that the locum signs off on, and our individual physician was at home for 2 weeks prior to coming to Thunder Regional Hospital, so he was not working in a hot zone.
Thank you. When a person is suspected of having exposure to COVID-19, what specific protocols come into play at the healthcare facility? And in this case, we'll speak only to an acute care facility like ours.
So right now, masks are mandatory. We all are wearing masks, and certainly if there's any direct patient contact, we have a full PPE worn. That's gloves, masks, goggles, and certainly hand washing is always encouraged. So full precautions are taken with every patient encounter. As you know, when you come to the emergency, it's a hot zone, and they're fully gowned and gloved on a regular basis, plus our renal unit with highly immunocompromised individuals. Greg, do you want to say anything else to that?
So this is Dr. Greg Campbell, infectious disease specialist.
And so that's the inpatient aspect of what goes on when you're a healthcare worker coming up here. You are also subject to a daily screen for COVID-19 or for COVID-19 symptoms, which you do need to complete on a daily basis. So that's, I think, also a very, very important component here. And then again, if you've traveled outside of Northwestern Ontario and you're coming up here, there's a protocol that's in place that is designed to minimize the chances that you will come up with any evidence of active infection. So there's stuff that goes on before the healthcare worker gets here. There's stuff that goes on just before the healthcare worker enters into the facility. And then once you're in the facility and working, there's a whole series of precautions that are in place. So there are multiple layers of protection. And so if in the unlikely event, and sometimes the unlikely event does happen, that somebody or something slips through, there are those fallback protections that should hopefully keep other healthcare workers and, of course, our very important patients safe.
Thank you, Dr. Campbell. I have another question for you, Dr. Kennedy, and then we'll ask Dr. Ahmed to respond to a couple of other questions. So follow-up question, Dr. Kennedy, how often was this person tested for COVID-19 before the positive test came back?
So this individual was tested at the very end of April and down in Eastern Ontario. There is no test performed until the test that was done yesterday on May the 31st. And the reason no test was performed is that he was declaring no symptoms that were outside his regular types of symptoms he's had with his chronic type of illness. Well, I shouldn't say chronic illnesses, regarding his allergies and some other minor medical conditions he had.
Okay, thank you. Next questions are for Dr. Ahmed. Dr. Zaki Ahmed is Chief of Staff with our hospital. He is also a medical specialist with the incident management team. Dr. Ahmed, these questions are largely regarding locum activity. Some of this has been addressed, but you may want to add some detail. Why are locums still being used at the Health Sciences Center? I believe out-of-town locums were not being used for a while. Are surgeons and other physicians being used at the hospital as well to not be dependent on locums?
Yeah, so in areas which are fairly specialized, so emergency room, critical care, so when the pandemic first started, we did go to a point where we were not inviting locums just because of the fact that at that point we wanted to really discourage travel. After 3 months of doing this for ongoing periods of time where you have physicians that are working double, triple of what they are used to working, it's not sustainable. So as we get longer and longer, you start getting burnout of physicians, and we still are at a point where we're locum dependent. These are highly specialized areas where we can't use physicians who are not trained in critical care or emergency medicine with high acuity patients.
Okay. So that actually covers locum questions, Dr. Ahmed. Thank you very much. Dr. Kennedy, I'll ask you to come up and address this next question, which is, how is the supply of PPE holding up?
So our supply of PPE is still critical. We are very fragile for the gown supply. We certainly have enough at this point N95 masks. We have sufficient gloves. But with this recent incident of exposure, we can certainly expose ourselves to increased use of PPE. We do expect sort of a shipment of reusable gowns coming up in the very near future, and we've actually have escalated our request for further PPE gowns to the Ministry of Health, given this situation and our potentially increased use of gowns. So it's still fragile. We've informed the staff. We're taking certain precautions to actually preserve the PPE the best we can, but we certainly can't mislead anybody that it is fragile, and the clinical staff is aware.
Okay. Dr. Kennedy, is there any look at changing how testing is now taking place, especially as the quick swabs are now running low?
Absolutely. So we've talked to Public Health this morning. The Public Health Lab will be up and running on Wednesday. They're bringing some expertise from their Toronto lab. We'll have the capacity to do 92 swabs starting Wednesday on a daily basis. We are still getting our 70 swabs of a week, and our BioFire, which is our in-house testing, will have capacity to do another 90. So, and into next week, the Public Health Lab will have capacity to do over 270 swabs on a daily basis. So by the end of next week, we should have capacity to do 2 or 3 hour turnaround time in Thunder Bay within 2 to 3 hours. So this is a really welcome type of testing we have to do, and we have to change our strategy now that we have rapid testing to do more aggressive testing of appropriate individuals, patients, as well as staff.
Thank you. Do we currently have any staff off due to this exposure?
Due to this exposure, we have no asymptomatic staff off at this time because the exposure was very low risk, but it was very widespread. If we took everybody off who had that exposure, we would not be able to keep an ICU open, an emergency room open because of trauma care. So it'd be certainly had major implications, and we need to take care of the health of the population.
Do you expect any positive cases to come out of this interaction between the physician and the patients?
Well, because my experts tell me that the risk exposure is very low, and given the incubation period of this virus and doing the contact searching Public Health has done, I do not expect any cases coming from this exposure because of the low risk, but that is why we're doing the testing, to make sure we look at containment and take all the precautionary measures. So I don't have the crystal ball, but I listen to my medical experts and my public health experts, and all the information we're getting now is the risk is minimal and low.
At this time, we're calling this a possible outbreak. Can you provide some information in terms of what defines an outbreak?
Dr. Campbell, Greg, you wanna sort of answer that for us?
Actually, you can take over my chair. Jay is going to read the rest of the questions
Okay, good.
because they're being submitted in
Good.
real time.
Yeah.
Thank you, Dr. Campbell.
So the current definition for a hospital outbreak is two laboratory-proven cases within the hospital with an epidemiologic link between those cases. So under the current situation, we do not have a hospital outbreak. We are investigating to see if there is any evidence of other cases and also if there is an epidemiologic link between those cases should they occur.
We've got a question here from Gary Grinney with Dougal, and he's asked, at what point did the doctor become symptomatic?
The, Dr. Med, Zaki, do you want to sort of, want me to answer that? I'm good either way. Okay, yeah. So he screened every day, as Dr. Gamma's outlined, and he screened negative to those symptoms. He was approached feeling ill on Sunday morning, more than he has been, and he was then sort of recommended to go for testing and taking some time off.
And at what point did the hospital become aware that he was symptomatic?
On Sunday morning, usually around 8 o'clock in the morning, he had the appropriate swab done, the appropriate investigations done, sent home, and then the swab came back positive late last evening around 8 o'clock.
And how many patients or staff may have been exposed?
So right now, we're looking at 11 patients, I believe, that's under investigations that are still in hospital. There are a number of outpatients also exposed. And staff, as said earlier in the report, was over 100 staff exposed. But again, this is low-risk exposure. So that's why I want to sort of, you can't underestimate, when you assess risk, you look at sort of high probability and low probability. This was low probability exposure.
On that note, question from Troy Charles at Dougal. What about this individual doctor's case leads you to the low-risk designation?
Okay.
The time course of the individual's illness would suggest that the infection probably occurred earlier on before the patient actually, or the individual actually arrived in Thunder Bay. And there are some very nice studies out there, some of them actually done in Winnipeg, which would suggest that once symptomatic, infected individual really is capable of spreading maximally in the first 8 days, and then after that it tailors off. Despite that fact, you can still detect with PCR testing the presence of the virus, but the actual ability of that individual to infect others is negligible.
We have a question here from Jody Lundmark at the Chronicle Journal. Was the physician using PPE when interacting with patients and staff?
Yes, the physician, when they come from a locum, they are sort of sort of mandatory to wear masks and gloves with all the patient sort of interactions, and certainly gowns when they come in closer contact with patients in isolation. But as you know, certainly it's difficult to keep that with 100% of the time. So there certainly may have been sort of breakage of protocol from time to time for short periods of time.
Question from James Murray at the News Ledger. What is the capacity for contact tracing?
Counter that, Greg?
I think our capacity is, let me put it this way, our capacity is more than sufficient at the moment. And I think both within the hospital and outside the hospital with our local public health unit, we're more than capable of addressing an issue even as potentially large as this one.
One here from Jeff Walters at CDC. Is the hospital doing any investigation into the behavior of the physician wearing PPE, etc., and how they could have passed it along to patients.
So I just want to emphasize, this was a physician this time, but all healthcare workers have that responsibility to do the appropriate screening. So this isn't a physician versus a nurse versus a housekeeper. This is a healthcare issue that we're going to run in from time to time. Getting to your question regarding investigation, yes, any physician, so certainly who has undergone a positive COVID-19, any nurse who has undergone a positive COVID-19 requires a thorough investigation to make sure protocols were followed.
And that's all the questions that we've had via email. There is about a 30-second delay, so we can give them a brief moment to catch up if they have any follow-up questions.
No additional questions? Okay. Well then, again, I'd like to thank our media partners for issuing the questions, for taking part in this session today. Anything you want to add, Dr. Kennedy, in closing?
No, I really do feel that the team that has been meeting since 9 o'clock last night is on top of things. We have met with every clinical unit. We have met with every department in the hospital. We have attempted to address their concerns, and there's certainly increasing fear, but I think there's also an understanding that with COVID-19 and the type of virus we're dealing with, this is sort of not a natural occurrence. It's an unfortunate occurrence, but one that we're working ourselves through, and there's certainly no need for panic at all. And I think rest reassured, our medical experts, our nursing experts, our senior administration team certainly are on top of it, and certainly even myself feel very comfortable that the exposure was low risk, and we should come out of this quite fine. But learning as we go all the time with this COVID-19.
Thank you very much, Dr. Kennedy. Thank you to Dr. Campbell and Dr. Ahmed. As part of our commitment to transparency, we will continue to provide updates. Thanks again for joining us.
Stream is off.
This is James with Net News Ledger. Stay tuned and stay safe and stay subscribed. Join us on YouTube or Facebook.